Really good to have you on board today, and thank you for joining us. Again, for our audience that is, again, around the country, around the world, this is a great time to talk about public-private partnerships. We know today in the ecosystem in healthcare, we've never seen a greater need for public-private partnerships in the history of healthcare, really, and without even being at all dramatic about it. With a virus spreading around the world, the need for the various cities, states, and countries to work together with private enterprise not only produced a vaccine in less than a year, but it's also now distributed a vaccine to billions of people around the world. Obviously, not enough has been done. We've seen that now with the emergence of a new variant, Omicron, and the need to improve the public-private partnerships even further. And this is again why, again, from the New York City EDC standpoint, and Monica Lawoni being here to talk a little bit about that and how to strengthen these partnerships in the healthcare ecosystem, and particularly with what the EDC has done in creating New York City as the top ecosystem in digital healthcare, which has been now, I think, if we look at the number of startups in New York City, the number of startups valued at $1 billion or more in New York City, whether it's click.com or row.com or OneDrop or many, many others. Obviously, metadata being in New York City. We just had a tribute to Glenn DeVries, the founder that passed away in the plane crash a couple of weeks ago, early this morning. So WebMD is in New York City. So the list goes on and on and on. And so we want to talk about that today with Monica from New York City EDC. Monica, let's start with just a little bit of a biographical sketch on yourself so the audience can get to know you a little bit.
Sure. Thanks, Stan, for having me. So I joined the EDC relatively recently, about 5 months ago, but I have a long career really in the public-private partnership space. I was at CUNY, the City University of New York, which is New York's public university system, before joining the EDC, where I worked on partnerships in the health and life sciences around workforce. But before that, I worked on Medicaid policy and Medicaid redesign, both in New York as well as in Colorado and New Jersey. So have a long history, as I said, in public-private partnerships. So EDC is a great place to be for that.
Absolutely, and you do have a master's in public health as well, so you understand healthcare very well. And coming from CUNY. I don't know if many people know this, but CUNY is the largest undergraduate institution of higher education in the country with a campus. So a lot of people will look at a lot of these online universities and be like, wait a minute, what about some of these others? They've got 500, 900,000 and 1.5 million. But in terms of schools with campuses, most people don't know that CUNY in the city of New York is the country's largest actual college university that we have in America. So an incredible institution. And then obviously you also went to Boston University School of Public Health, correct?
I did. I did my master's in public health at Boston University, and I also did my undergraduate studies in Boston, well, in the Boston area at Tufts, in clinical psychology. So yeah, I started my career really in clinical psychology research, and then went into health services research, looking at access to care and better understanding consumer behavior in the healthcare space. And then got involved in some publicly funded demonstration projects in New York, hospital medical home demonstration project first at Maimonides Medical Center. And then I joined the Medicaid DSRIP program, which is Delivery System Reform Incentive Payment Program. For those not familiar with that acronym, I worked on that for about 4 years. Mostly in New York, but as I mentioned, also worked on similar programs in New Jersey and Colorado, and did some work with some other localities as well as a consultant.
Truly impressive. And again, for those of you who don't know about the School of Public Health at Boston University, their dean, Sandra Galeo, a former colleague of mine from Columbia School of Public Health when he was running epidemiology in that department, for about 10 years. Just a brilliant thinker, a wonderful writer, and a great all-around person. So anyway, nice connection there to New York City as well. And Monica, talking about New York City, it is an extraordinary place to be for public health. You see everything from just the social determinants of health and healthcare deserts and certainly nutrition deserts, whatnot. What are some of the big challenges that you're seeing where public-private partnerships are really critical in this juncture to help with really fortifying and helping out the New York City's neediest right now?
Sure. I mean, I think that, well, first, let me just say that I think public-private partnerships are not just at the core of what EDC does, but also of who we are. So for those who may not be familiar with the EDC, we are the New York City Economic Development Corporation. We are a quasi-government agency. So we're both a steward of city resources, but we are a nonprofit organization. And almost everything that we do involves partnering with or funding private institutions, for-profit and nonprofit both. And I think a really good example recently, and that is in response to a need right now in the city, is the Pandemic Response Institute, which we just announced. And we announced last month that we had selected Columbia University to lead the Pandemic Response Institute with the City University of New York as a key partner. And there are two incredible public health experts that are leading from these institutions, one private, one public. So Dr. Wafa Al-Sadr, the founder and director of ICAP at Columbia, and Dr. Ayman Al-Mohandes, who's the founding dean of the CUNY Graduate School of Public Health and Health Policy. We have one of the world's largest and oldest public health departments here, the New York City Department of Health and Mental Hygiene. And this institute is, and it will be, a product of a close partnership between EDC and the Department of Health. But the PRI is a new entity, and it will be dedicated to preparing New York City for future pandemics and public health emergencies. And the idea really is to double down on the best aspects of the city's response to COVID-19 to make those permanent, but also address gaps in the health infrastructure for the future. And across all the Institute's work, there will be a focus on embedding a racial equity lens and ensuring that we drive towards recovery for all communities in the city. It really builds on the mayor's long-term recovery agenda, which places public health and social justice at the center of New York City's recovery. So for instance, PRI will use a hub and spoke model with a geographically accessible hub like Harlem, and then neighborhood-based spokes that will allow communities across the city to have closer proximity to, access to, and really input into the Institute's activities. So, one work stream that I think we could highlight here in the PRI is around innovation and scaling. The PRI will help identify and pilot innovations that improve health emergency preparedness and response. And at the same time, ensure that all New Yorkers have access to those innovations. I think, and this is me personally, that this is a great example of where private-public partnerships are really important. Private industry brings the strength of speed, of risk-taking that's maybe a little bit harder for the public sector. But the public sector, government, can bring in this equity lens and, this insurance, this prodding to make innovation serve the public equitably. And of course, government is also an important payer. Ultimately, when we think about innovation in the health and life sciences space, but that's a little outside perhaps the EDC's purview.
That's fantastic. And again, the work that EDC and HITLAB have done over the last 6 years now with Breakthrough Alliance, which is chaired by William Toronto, who's the CEO of the Merck Global Health Innovation Fund, the $1 billion digital health fund that brought out Livongo and Preventus and numerous other digital health startups, or certainly many in the New York metro area as well. The Breakthrough Alliance was a great example of that, where It was using the lab's evidence-based testing as a foundation to help bring not only startups up and running. Have several of those now that have really succeeded, but by using the EDCs, not just the expertise in life sciences, but also the connectivity around the New York City metropolitan zone, it really did help with the development of a digital health ecosystem and help thrive within that young emerging technology startup area. And I think it created now a board of 27 different people who are on the Breakthrough Alliance board and actively engaged with monthly meetings on how to align to help that. And a lot of those folks include people like New York Presbyterian and certainly folks from Metadata and others who are big ecosystem stakeholders that are learning from these evidence-based studies how to better utilize digital health in their operations, working with their patients, and obviously investing in those too. We have a number of folks like Harsha Murthy from Consummate Capital, who are big investors in life sciences, who are a part of that ecosystem alignment. How important is alignment when you look at alignment within that public-private partnership and looking at how EDC brought in HITLAB with that grant to really start up Breakthrough for the first 3 years and then really take it out and scale it after that alignment? Would you say that's one of the cornerstones of public-private partnerships, or what are some of the other ones that you would mention that are important to the ability for small, agile private institutions to work with larger, again, more rigorous and expert government institutions?
Well, I think alignment definitely is key. The breakthrough tech, it precedes my time at EDC. So I can't speak to sort of the thought behind that. You could probably do a better job, Stan, of talking about that. But alignment is very important, because we're a public entity. In fact, a lot of the work we do is procured, and it goes through a pretty rigorous process of review, competitive procurement processes mostly. So alignment is certainly something that we look for. We're looking for folks that have experience in, whatever it is that we are looking for. So really looking for, not just folks that want to do the thing that we're trying to do, but that also can deliver, because we have I guess speaking as a public quasi-government, quasi-public entity, we do have a responsibility to make sure that we're responsibly using the public's money. So I think we look for, demonstrated experience in, a given area, and certainly, yes, like alignment. So I think alignment really, is key. Also, cultural alignment, I think is part of that. It's not just alignment needs to be delivered, but, do we have a shared kind of vision for what it is that we're trying to do?
That's brilliant. And one of the things that always struck me about New York City is that it is an amazing ecosystem in terms of its roots, its foundations for life science invention. It has, things like Wall Street, Madison Avenue, even, we look at the 3 of the country's top 25 medical schools, 2 of the country's top 5 medical schools. We have, the nation's largest hospital, HHC, the Health and Hospitals Corporation. We have the nation's largest private hospital, New York Presbyterian. It just, the list goes on. Even institutions like Rockefeller University with, so many Nobel laureates just get lost in the shuffle. If you took Rockefeller University and you put it out in Minnesota, everyone would know about that, right? But in New York City, it's such a massive city that so many of these healthcare juggernauts and institutions get lost in that shuffle. In looking at this and looking at the future of life sciences in New York City and the future of these sorts of partnerships over the next 10 years, where does New York City EDC, where is the Economic Development Corporation planning on taking a lot of this? What are some of the areas that EDC plans on focusing?
Well, I mean, you talked about, top medical schools, some of the top companies in the country. But I mean, the life sciences industry has been growing tremendously in New York City. It's also been incredibly resilient in the face of the pandemic. I think this is part of why the city recently doubled its investment in LifeSci NYC from $500 million to $1 billion. You gave some facts and figures. I'll give some as well. We're ranked second nationally for bioscience jobs and for higher education degrees in biological sciences. New York City life sciences jobs increased at a 3.6% annual rate over the past 5 years, even while employment citywide was declining. Earnings for life sciences employees increased from $85,000 a year in 2010 to now $142,000. Yes, some of the top life sciences employers are in the city, Pfizer, Schrödinger, but there's also a tremendous amount of VC funding coming into the city. So we went from $350 million in VC funding in 2015 to almost $2 billion last year. We're on track to even surpass that this year. That's reflected in the number of companies that we now have, from less than 150 5 years ago to almost 300 life sciences companies now. And we have way more space for the industry. So we went from just over 1 million square feet of life science space 5 years ago, now projecting 3.5 million square feet in the next 2 years. But if we're talking about the future, then I think we need to talk really a bit more about equity, because that's really central to our mission and it's central to our strategy for the life sciences. So one way that we're thinking about this, or two ways, is how can we ensure all New Yorkers are benefiting from this industry? And how can we ensure all New Yorkers actually have the opportunity to work in this industry? So for instance, we've had a LifeSci NYC internship program since 2017. We've placed over 400 interns at life sciences companies, large and small. So from Pfizer to one-person startups, 40% of those placements have converted to full-time roles at the end of the internship. Half of those interns have been women, 75% have been non-white students, and a significant proportion have come from CUNY. So it's really proven to be this amazing and diverse pipeline. And now with the city's doubled investment, we're going to be able to expand this program and serve even more students of all backgrounds, even more companies. So to all those in the audience that have companies in New York City or thinking about expanding to New York, please reach out if you need an intern. Another thing we're really pleased about, in tandem with the development of one of the projects we recently supported, which is the Cure facility that just opened on Park Avenue South ahead of schedule. Deerfield Management has launched the Exceed Award. This offers prizes of $100,000 to minority and women-led startups. And earlier this month, the second round of the award was announced, along with the theme for this year, which is neurodegeneration. So another invitation to founders from groups that are currently underrepresented in the industry, please take a look at this opportunity. But we're also really focused on strengthening neighborhoods and ensuring that communities across the city can benefit from the economic opportunities that come with these new developments. So we want to see life sciences across the city. For example, we recently announced that we're awarding $50 million in city capital to improve facilities at the Brooklyn Army Terminal, BioBat, on the Brooklyn waterfront. Another recent example, InnoLabs in Long Island City. Long Island City is a hub that didn't exist 5 years ago for health and life sciences. And now we have Alexandria there, King Street Properties. So our hope for the future of health and life sciences in New York City is that it actually looks like the people of New York City and it serves the people of New York City.
That is well put and well spoken, and a good way to cap this off. Monica, thank you very much for joining the program today. Again, our audience from around the world looks to New York City not only as if you can make it there, you can make it anywhere, but it's also a lot of the folks that we work with are using New York City as their launch pad as they come in from England, or they come in from France or Israel or India, they look at New York City as a great place to enter the US, gain some ground. New York City is an amazing digital health ecosystem. And again, it's all thanks to EDC and what you guys have done. So just tremendous to talk with you today. And thank you again for joining us.
Thanks, Stan. Thanks, everyone.